Hello and welcome back to the Herbal Podcast, where we discuss all things herbs and horses to help you and your horse live a happy, healthier life, naturally. I am Kayla Dendy, your master herbalist, and today I will be discussing buckthorn, an herb that is a gentle laxative, but has also been shown to be toxic to horses. As always, please speak with your doctor or veterinarian before utilizing herbs or alternative medicine. This podcast is for informational purposes only, and is not intended or designed to be a substitute for qualified medical advice. Buckthorn, also known as Rhamnus frangula, is a fascinating shrub. It is an invasive shrub in parts of the United States. The shrub typically grows between 10 and 15 feet high and thrives in wet locations. It can be distinguished from common buckthorn by its more tree-like habit and notably the absence of any thorns on its branches. Geographically, buckthorn is widespread, growing throughout Europe, Siberian Asia, and the northern coast of Africa. It has also become naturalized in parts of the United States and England. Its history stretches back to the Anglo-Saxons, who recorded it in the 9th century as waythorn or hartshorn. Later, in the 13th century, Welsh physicians utilized its fruit boiled with honey. Despite its historical use, one of the most critical facts about this plant involves safety. Only the dried bark, seasoned for at least a year, should be used internally. The fresh bark is toxic, causing severe reactions like nausea, colicky pain, violent vomiting, and diarrhea. Furthermore, the fruit of the shrub is considered poisonous and unpalatable to humans, and ingestion of the leaves or berries has poisoned children. In fact, the branches of alder buckthorn have been reported to cause poisoning in horses. The seasoned bark's primary use, however, is medicinal, valued today mainly as a laxative and cathartic. It is considered a milder and more agreeable substitute for the drastic juice of the common buckthorn berries, Rhamnus cathartica. Its medicinal properties are attributed to anthornoid compounds, including the chief constituent, the glucoside frangulin, or rhamnoxanthin. Frangulin and its derivative, amodin, are only found in aged bark. The mechanism of action involves these compounds irritating the walls of the large intestine, which intensifies peristaltic movements and increases water secretion, making the digestive contents more fluid. Beyond its internal uses, the bark and leaves of buckthorn have been historically utilized to yield a yellow dye, and the unripe berries produce a good green color, famously contributing to the watercolor pigment known as sap green. The wood itself is also prized for making charcoal, which, being light and highly flammable, was preferred by former-day gunpowder makers, who dubbed the plant black dogwood or powderwood. The medicinal properties and safety of its internal use have been approved by the European Medicines Agency, EMEA. However, patients must be cautious, as alder buckthorn, a stimulant laxative, can interact with several medications, including digoxin, certain medications for inflammation such as corticosteroids, other stimulant laxatives, and water pill, diuretic drugs, as these combinations risk decreasing potassium levels too severely. It can also increase the risk of bleeding if taken with warfarin due to potential diarrhea. The plant, commonly referred to as alder buckthorn, or sometimes improperly as black alder, is botanically known as Frangula alnus mill, or Rhamnus frangula. It is a smooth shrub that typically grows to a height of about 10 to 15 feet. Buckthorn thrives in wet locations and is widespread. The shrub can be found throughout Europe, Siberian Asia, and the northern coast of Africa. It has also become naturalized in the United States and England. It is often described as having a more tree-like habit compared to common buckthorn, and notably it lacks thorns on its branches. The alder buckthorn possesses alternate leaves. The leaves are entire, meaning they are not toothed, and are described as elliptic, oval, or obovate. They are generally broad, blunt, or sometimes slightly pointed at the apex. The undersurface may be faintly downy. A key identifier distinguishing it from common buckthorn is that its leaves are entire and feather-veined, and all are arranged alternately on the stem, with none opposite one another. The flowers are small, greenish, and hermaphrodite. They appear in axillary clusters of 3 or 5. Alder buckthorn produces small berries. These berries are about the size of a common pea. They transition in color, starting red and ripening to nearly black. Each berry contains 2 or 3 roundish angular seeds. While these fruits are attractive, which aids in wide seed distribution, earning the name bird cherry, the fruit is considered poisonous and unpalatable to humans. Ingestion of the berries has poisoned children. The bark, which is the part used medicinally, is collected from younger trucks and large branches. It typically occurs in single or double quills, and is usually from about 1 millimeter thick. The outer surface is grayish-brown or blackish-brown and is marked with numerous small, whitish, transversely elongated lenticles. The outer layer features a purplish cork. If the outer cork cells are scraped away, a dark crimson inner cork is revealed. The inner surface of the bark itself is smooth and pale yellowish-brown. I've given you a little introduction to alder buckthorn, but as you plan on using or harvesting this shrub, you must be absolutely clear on what parts are used and, more importantly, how to process them safely. This plant is a fascinating example of how improper preparation can turn a useful medicine into a dangerous toxin. For internal medicinal use, specifically as a laxative or cathartic, only the dried bark is officially recognized and should be used. This bark is collected from the younger trunks and large branches of the shrub. The bark preferred for medicine is usually obtained in narrow, single, or double quills, about 1 millimeter. When you look at the outside, it is generally grayish-brown or blackish-brown and characterized by numerous small, whitish, transversely elongated lenticles. If you gently scrape away the outer cork layer, you will expose a distinctive dark crimson inner cork. The inner surface of the bark itself is smooth and pale yellowish-brown. When the dried bark is chewed, it colors the saliva yellow. This dried bark is nearly odorless and has a sweetish and bitter taste. It is critical to understand only the dried bark, seasoned for at least a year and preferably longer, should be used for internal ailments. The bark is officially specified by the United States Pharmacopoeia to be collected at least 1 year before being used. The ingestion of fresh bark produces severe effects, including nausea, colicky pain, and violent vomiting and diarrhea. When the bark is properly dried and aged, it loses some of its acridity and acts solely as a purgative. Furthermore, the primary active components, the glucosides frangulin and its derivative amodin, are only found in the aged bark. Beyond the fresh bark, no other part of the plant should be used internally. The fruit, or berries, is considered poisonous and unpalatable to humans. Narcotic symptoms have been produced by eating the berries and seeds. Children have been poisoned by eating the leaves or berries, which cause great dryness of the mouth and throat, intolerable thirst and nausea, vomiting, severe stomach cramps, and violent purging. The branches of the alder buckthorn have been reported to cause poisoning in horses, leading to symptoms like colic, diarrhea, weakness, and paralysis of the hindquarters. The collection of the bark is typically done from wild shrubs, though the species can be cultivated. The bark is best collected in late spring or early summer. Once stripped, the bark is dried on sunny days. It can be dried outside in half shade or by moderate artificial heat, typically on shelves or trays in a warm, well-ventilated room. Crucially, the stripped bark must be stored and aged for a minimum of 1 year before it is considered safe and medicinally active. While the bark is the focus of internal medicine, other parts of alder buckthorn have significant historical and industrial utility. The bark and leaves yield a yellow dye. When mixed with iron salts, it turns black. The unripe berries yield a good green color, which constitutes the famous watercolor pigment known as sap green. Ripe berries yield shades of blue and gray. The wood of the shrub, after the bark is removed, is prized for making charcoal. Because this charcoal is light and highly flammable, it was historically favored by gunpowder makers, who often referred to the plant as black dogwood or powder wood. We've established that the alder buckthorn is a plant with potent medicinal properties, provided it's properly prepared. But how far back does our relationship with this smooth shrub go? It turns out, the history of buckthorn is woven deep into European and North African culture, spanning well over 1,000 years. The genus name itself, Rhamnus, is derived from the Greek name rhamnos, which simply means branch. Historically, there is also a related species, the Palestine buckthorn, that is said to have been the plant used for the crown of thorns at the cross. More recently, archaeological evidence points to its long use. The abundance of alder buckthorn was discovered in the ruins of the ancient city of Dasilium, in the province of Baykasira in northwestern Turkey. For at least several centuries until today, this plant has been a popular herbal resource across Europe, including the British Islands, the Carpathian region, and the Balkan Peninsula. Moving into the European medieval period, we find clear records of its use. The Anglo-Saxons recorded it in the 9th century, knowing it by the names waythorn or hartsthorn. In the 13th century, the Welsh physicians of Midvi utilized the plant's fruit, which they boiled with honey. As herbalism developed into formal medicine, buckthorn maintained its prominence. 300 years after the Welsh physicians, around the 16th century, the English herbalist Gerard recommended boiling the fruits with broth. The syrup of buckthorn was included in the German pharmacopoeias, almost a century earlier than it appeared in London. It was finally included in the London Pharmacopoeia in 1650. Interestingly, when it was first introduced into these formularies, it was often mixed with spices like nutmeg, cinnamon, aniseed, and mastich, a gum, as the fruits were rarely taken alone. In Victorian times, a syrup of buckthorn was prepared using sugar and ginger, often administered to children as a purgative, although this specific syrup has since fallen out of present-day use. Beyond its internal use, alder buckthorn has a significant industrial history, often tied to its physical properties. The bark and leaves yield a yellow dye that was extensively used in Russia. When combined with iron salts, this dye turns black. The ripe berries yield shades of blue and gray, and the juice of the ripe berries was historically used in country areas to make ink. Today, alder buckthorn bark is officially recognized in pharmacopoeias, and its medicinal properties and safety of internal use have been approved by the European Medicines Agency and the Committee on Herbal Medicinal Products. Its modern application is primarily as a laxative and cathartic, and it is considered a milder and more agreeable substitute for the drastic action of common buckthorn berries. It has, however, fallen into neglect compared to the much more advertised and endangered Cascara sagrada. From ancient ruins to medieval potions, gunpowder, and watercolor paints, the history of alder buckthorn reveals a plant consistently valued across many spheres of human activity for centuries. While its history is long, its current use is sharply focused, and understanding its mechanism as well as its safety profile is vital. The primary and most widely recognized clinical use of properly prepared alder buckthorn is as a laxative and cathartic. The medicinal properties and safety of the bark for internal use have been approved by the European Medicines Agency and the Committee on Herbal Medicinal Products. The bark is also official in both the United States and the British Pharmacopoeia. Alder buckthorn bark is valued for treating conditions like long-term constipation because it is considered gentle and non-addictive. It is sometimes prescribed when a thorough and quick evacuation of the bowels is desirable, such as taking a dropperful at bedtimes. Alder buckthorn is considered a milder and more agreeable substitute for the intensely drastic action of the juice derived from common buckthorn berries. Its action is often compared to that of senna and rhubarb. Alder buckthorn does not have much, if any, use in veterinary medicine. There are other herbs that are considered more desirable to utilize when addressing bowel complaints in animals. Fresh alder buckthorn branches have been found to cause toxicity in horses. Never feed fresh buckthorn bark to your animals. It will cause severe side effects. Also, the berries and leaves are toxic and should not be given to animals. Cascara sagrada and senna are better alternatives to provide to animal with constipation or bowel issues. The clinical effect of alder buckthorn is due to its chemical makeup, specifically the presence of anthracoid compounds. The chief constituent is the glucoside frangulin, also called rhamnoxanthin. This compound, along with its derivative amodin, is only found in the aged bark. When ingested, the anthracoid substances are absorbed into the bloodstream from the small intestine and quickly pass to the large intestine. Here, enzymes and bacteria hydrolyze and reduce them into their active forms. These active forms then irritate the walls of the large intestine. This irritation causes two primary effects. First, it intensifies peristaltic movements, speeding up the displacement of residual food content. Second, it increases the secretion of water into the large intestine lumen and inhibits water resorption. As a result, the digestive contents become more fluid, leading to evacuation. Since the compounds must travel to the large intestine and undergo this enzymatic process, the effect of alder buckthorn is generally observed 8 to 12 hours after consumption. While the primary clinical use remains as a laxative, anthracoid compounds found in alder buckthorn are currently being investigated for broader pharmacological potential. Anthracoid compounds are known to exhibit antioxidant, antibacterial, fungicidal, antiviral, and anti-cancer properties. One specific anthra compound, hypericin, has even been recognized as a substance that may help cease the symptoms of depression. Recent microbiological studies have yielded fascinating results relevant to gut health. Research has demonstrated a positive effect of alder buckthorn extracts on probiotic bacteria of the Lactobacillus genus. This suggests that using these extracts may not have a direct negative effect on the existing gut microflora. Research has also shown that contact with the extract may reduce the total permeability of bacterial cell membranes. This finding opens the possibility of using alder buckthorn extracts as a factor regulating transport into cells, potentially supporting the activities of other bioactive substances. Despite its approval for internal use, the clinical application of buckthorn requires strict adherence to safety rules, especially concerning preparation and interaction with other drugs. Only the dried bark, seasoned for at least a year and preferably longer, should be used for internal ailments. The fresh bark is toxic, causing violent vomiting, nausea, and diarrhea. Furthermore, no other part of the plant should be used internally, as the fruit and leaves are considered poisonous to humans. Because alder buckthorn is a stimulant laxative that affects the movement of fluids and electrolytes, it interacts with several classes of drugs, primarily risking a dangerous decrease in potassium levels. Low potassium levels caused by the laxative can increase the risk of side effects from the drug, digoxin. Taking alder buckthorn along with medications for inflammation like prednisone or hydrocortisone may decrease potassium in the body too severely. Since diuretic like furosemide or hydrochlorothiazide also decrease potassium, combining them with buckthorn may lead to dangerously low potassium levels. If buckthorn causes diarrhea, it can amplify the effects of warfarin, thereby increasing the risk of bleeding. Patients on warfarin should speak with their doctor prior to taking alder buckthorn. As a laxative, buckthorn can decrease the overall absorption of other medications taken by mouth, potentially reducing their effectiveness. Always consult your doctor, pharmacist, veterinarian, or other qualified medical professional before taking alder buckthorn. As we wrap up our deep dive into alder buckthorn, it's clear that this seemingly common shrub, known historically as waythorn or hartshorn by the Anglo-Saxons in the 9th century, holds a powerful and complex profile. The most crucial takeaway is the absolute necessity of proper preparation. While the bark of Rhamnus frangula has been a popular herbal resource for centuries, and its medicinal use is approved by various authorities, only the dried bark, seasoned for at least a year, or preferably longer, should ever be used internally. Fresh bark is toxic, producing acute symptoms like nausea, colicky pain, and violent vomiting and diarrhea. This toxicity highlights the chemical transformation that occurs during the aging process, which is necessary to yield the active, gentler purgative compounds like frangulin and amodin. Furthermore, other parts of the plant, including the fruit and leaves, are poisonous to humans, and ingestion has poisoned children. The branches themselves have also been reported to cause poisoning in horses, leading to symptoms such as colic, diarrhea, and paralysis. Today, the seasoned bark is officially recognized in pharmacopoeias and used mainly as a laxative and cathartic, valued for its ability to treat long-term constipation because it is considered a milder and more agreeable substitute for the drastic action of common buckthorn berries. Its mechanism relies on anthracoid compounds that irritate the large intestine wall, intensifying peristaltic movements and increasing water secretion, leading to an effect observed 8 to 12 hours after consumption. The anthracoid compounds in alder buckthorn possess a range of pharmacological properties, including antioxidant, antibacterial, fungicidal, antiviral, and anti-cancer effects. Alder buckthorn stands as a powerful testament to natural medicine, a resource that provided the sap green pigment for watercolor painters and powder wood for gunpowder makers, and now offers a reliable remedy for constipation. However, this utility is contingent upon respect for its requirements, time, careful preparation, and acute awareness of its potential interactions. Thank you for joining me for today's discussion on buckthorn. Next week, I will discuss buggleweed. I hope you take time to tune in next week for that discussion. As always, this podcast is for educational purposes only. The information contained in this podcast is not intended or designed to treat, cure, or prevent any illness or disease. This podcast is not designed as a substitute for advice from your medical provider, veterinarian, or other qualified healthcare professional.